And thank you everyone for obviously joining us this evening. For the foundation, this is our 10th year of operation. As also Zesh's 20th year of as a professional player. As also for the foundation itself, there's 2 milestones for us. And from now on until throughout the whole year, actually, we'll be doing more events like this, linking with the Surrey FA and other partners as well. The foundation, our aim when we first started it, and it always has been, just to increase participation of all levels of the game, from chairmen to managers, coaches to referees. So we want to see a better representation of Asians and minority groups across all levels of the game as well. Tonight, we've got a special guest in Dr. Imtiaz, who I've known personally myself over the last 4 or 5 years, and who's supported myself and my family in someone who had mental health issues. And I know the importance of talking to someone and reaching out to someone. And I'm sure, during this lockdown period that we've all been in and coming out of it now, there'll be a lot of young players that we're working with and people that we know. And it's nice sometimes just to put an arm around them as well and really get people talking. Mental health can affect anyone at any age. Difference to that as well. We have had some great questions coming, and if we don't get around to answering all your questions, Dr. Imtiaz has agreed to give you a private response as well. Okay. So what I was thinking was, Doc, to start with, could you just maybe give us an introduction to yourself? I know you got a short presentation, your current role at QPR, and then the work you've been involved in around mental health and football restart as well.
Yeah, great. Thank you, Riz, James, and everyone else. Delighted to be here with you for the next approximately an hour or so. So I work currently as the head of medical at Queen's Park Rangers. I've been here since 2016. I've worked in football for around 15, 16 years now. So before QPR, I was at Tottenham Hotspurs. I was the academy and development team doctor over there, and then I was a club doctor at Millwall Football Club before that. I've also worked for the Women's FA, so for England, doing trips with England when I first became a sports medicine doctor. I still work as a GP, so I'm speaking to you now from my GP practice. And I do some work in cricket for the MCC and the Pakistan cricket team as a medical advisor whenever they come over to England.
You've got a few shirts in the background there. What are they?
Yeah, so they're from all the teams that I've worked with. So that's you can see the England women's football team, Queen's Park Rangers next door, and also Millwall, and I've just got a few others around the place. So yeah, that's me really in a nutshell. I've got a special interest in mental health in football, and in particular in communication in football. And one of my main areas of interest actually is communication between coaches and players. So I'll share some of my thoughts because I think there's quite a lot of crossover for that, and you'll see kind of a general theme about that during my presentation and the questions I answer afterwards.
Cheers, Doc. Following on from that as well, some of the questions that have come in, like I said, I won't go through all of them. Hopefully you can cover these in your presentation as well.
Yeah.
First one is, what can we do to help new players to adopt quickly the new teams they join, as there may not be much training time before and after the first game?
Yeah.
And what is the best practice to support players during, after the return to football with their mental health? They may have concerns about completing the NHS test and trace registration forms.
Yeah.
And another one is, which is a really good question actually, is seeing these difficult times, deaths and a sudden stop to sport, many athletes have gained weight or had their fitness levels reduced, which has therefore made athletes, players more anxious and worried for the return of play regarding their weight or just appearance. This then leads to anxiety, which can be triggered. How would this necessarily be targeted and treated, as simply telling them you need to lose weight will only make it worse in their opinion? So there are a couple of questions there that I'll pose to you now. So if you can cover those in your presentation, that would be great. At the end, if you guys do have questions, please put them in the chat or just put your hands up and we'll come to it at the end. Over to you, Doc.
Okay, I'll just share my screen. I take I've got around 25 minutes or so, but just give me a shout if it goes on too long. So and I can easily come out of this. Okay, is that shared? Yeah. Okay. Okay, great. So I've talked about most of the things on the screen, but I just want to start off by talking about the badge in the bottom right corner, which is Coping Through Football. And that's a charity between the London Playing Fields Foundation and Leyton Orient Trust. which essentially is a charity that gets together people with severe mental health illness once a week to play football as part of their therapy, part of their treatment. So it's actually it's an organisation that I do some voluntary work for, and I give them talks in terms of the players and also coaching staff just around that. And it's a really nice reminder for me that football, exercise itself, is a form of treatment. It's a form of therapy, getting together, that social interaction, the increase in bonding between players and staff, physical, mental health. It's been shown in research to increase confidence, self-esteem. It's shown to actually have positive impact socially in terms of opportunities and employment. People who are in the program tend to have less behaviours such as alcohol and drug misuse. And just in general, they feel better about themselves, especially when they engage with something. So just in itself, return to football, return to being in that team environment in itself has got some evidence that it's a form of treatment or a form of therapy. What I'll do now is just talk a little bit about my working environment. And the reason why I want to do that, because I understand there's many coaches here coming from various places, both in England, in Surrey, FA, and also around the world. And I think whenever we're thinking about our impact on players and our impact on culture and environment, it's really important, I believe, to kind of think about the organisation you work for, think about what you're doing, and think about where you want that organisation to go, because we're working for an establishment and players are there as well. So we're all trying to achieve something. So if you can understand it, I feel that helps with your relationships in football. So myself, as I've mentioned, let me just have a look. I work for Queen's Park Rangers, which is now called the Kian Prince Foundation Stadium, after one of our under 16 players who unfortunately died in 2006 with a single stab wound to the chest. So his father set up the Kian Prince Foundation, and the stadium was named after it. In a couple of seasons ago, which is quite a big deal for us. And his father came and spoke to the motivational speech and talked to our players, and something that we feel puts us in a good light and just gets us closer to our own community. When I joined in 2017, it was quite 2016. Soon it was the Grenfell disaster. If many of you aren't aware, it's a block of tower flats in West London that unfortunately set on fire, and 72 people lost their lives. So we as a club, we did a lot of work in the community for that, and ended up doing a charity match, which raised almost £500,000 for those survivors and their families. And we had many celebrities over there, and it was a great day and a great event. But the key thing was we also included many of the people who'd survived, and also some of the firefighters. So again, it was a nice way to kind of come back and give something to the community. So that's something that I think we, as a club, we've got a lot of pride in our relationship there with the community. Another thing we're doing as a club is we've changed. So I did mention I joined in 2016 and 17, and you can see here, just as an overview, in the last few years, many of our starting appearances and total appearances for the club has been from academy graduates. So as a club, our players are getting younger and younger. Certainly some of our staff, like myself, are getting older and older. So we're kind of moving as we get more experience, and moving away from the age group, the very age group that we're trying to influence. So that's something to bear in mind wherever you're working in football. And in the championship ourselves, we're the second highest in terms of minutes and percentage minutes from our graduates. So it gives an idea that in a club like ours, we're working with young players. We're trying to develop them. We're trying to make them into better footballers, for sure, but also better people who can thrive in our environment and also outside our environment, because they may well go on to do other things for other clubs in football. Now, when we start talking about mental health, this is actually stats from the UK, and actually nothing to do with football. Just in general, mental health affects 1 in 4 in the general population in the UK. At any one time, more than 10% can have depression. When we think about risks, it's the leading cause of death. Suicide is the leading cause of death in those under 45, and there are 12 suicides in men per day. So when you actually think about those stats, it's a big problem. You can see that I think in recent years we've all noticed that it's been taken, I believe, more seriously, and people are talking about mental health a bit more than they would before. But we always just get to kind of hear about what Riz actually mentioned. It's good to talk about it, good to talk about what can we actually do in our environments to make them better for our players and our staff, so that therefore we can actually recognise some of these issues and actually do something about it. So when we actually then translate that into football, football is big news due to high-profile cases, and many of us would have heard in the mainstream press about players who have secret battles with, or not so secret battles with depression or anxiety. It affects their performances on the pitch and actually off the pitch, and actually can affect many of the things that actually led them to being successful. So really, one of the things to say is I still work as a GP with non-footballers, non-professional footballers, and it's a societal problem. It's something that actually can be exacerbated within certain organisations, and football is one of them. So it can affect that at all levels. Now, in professional football, where I do the majority of my work, we do have support systems within the club, which I'll touch upon, but also extended wider with the PFA, which I know Riz does some really good work for, and they have a player welfare system where players can contact them, where they've got trained psychologists that can provide support and counselling. They also introduced mental health first aiders in the Premier League in 2014, and that's been shared across widely across the EFL as well. So it's something that professional footballers know they can access. In the general population in the UK, people can access counsellors via their GP. So firstly, you can speak to a GP, and they can often help with mental health issues, because it's kind of one of the bread and butters of general practice in the UK. So they'll be very experienced with managing common mental health disorders such as anxiety, such as depression, such as addictions, and they can then signpost towards other services, which again I'll touch upon as the presentation goes on. So some of the photos and stuff that I'll share are from are not confidential, because they're in the mainstream press, as you can see, and they're players that I've known very well, who are very happy talking about their story now, because their story could have ended their careers, and they've kind of all chosen different ways and have different support systems to be able to get through them and still be successful at a very high level. And I think that's probably been one of the biggest changes that I've noticed in football recently, certainly, where in professional football, people are more open to kind of actually sharing their stories. It's not seen so much as a sign of weakness as it may have been seen before. In terms of Mind is a charity that actually is working with the English Football League, and they've partnered together. So one of the slides that I showed before is a picture. They partnered together in 2018, and it's a charity with excellent resources that any professional and non-professional people can actually access. So what about COVID? So I've talked about before, or outside of football, I've talked about during football in the last few years, but COVID has changed the game as such for many of us. And before we started the presentation, I had a brief chat with Zesh, and he's explaining the situation in the country where he's in, where they were in lockdown, came back to playing, and now they're back in lockdown again. And it's an evolving time for all of us. So I'm sitting here now in the UK, and we're due to go back into training tomorrow. We've had our test, and everyone's ready to go back in. But if the numbers show a spike in the UK, then we might have to revert back to those days of lockdown again. So it's something that we've spent quite a lot of time, myself, the manager who's pictured over here, and Les Ferdinand, in terms of communicating a plan with ourselves as part of the senior management team, but also then relaying that across to all of our staff and to our players. So one of the key things I'd say in any organisation, whether it's professional or not, is to make sure you communicate any of the information in the right way. So I think getting information, getting the right type of information, understanding it, and then relaying that to your team in the right way, I think has been a really, really big part of what we've done. A few months ago, as soon as you turn the news on, it was all about COVID, you couldn't really see anything else. But a lot of the information you got was mixed from some quarters. So actually, what kind of information are you accessing? What kind of information are you using to talk about with your players and with your staff? So we try to use the Public Health England website to see any kind of information, and also the government website. So we're checking that now as well, especially with the changes in travel. We're always updating that and making sure that we all understand any changes, and then we can then relay that information to our players. So during lockdown, that's what we did, and certainly post lockdown, that's what we're continuing to do as the new season commences. I did an infographic with in the BMJ with some colleagues, and we really covered how we did our risk assessment. So the risk assessment is just making sure that we're ready as an organisation for the return of our players, and it did include physical and mental health as well. So we wanted to make sure that the environment was such that it was ready and safe for players to come back. We had to make sure that all the testing processes were on point, and the players knew about that. We took little videos. We had Zoom conference calls like we're doing now, but videos that we're sending to players. We've got an app so players can tell us if they've got any physical or mental health issues beforehand, and that monitoring goes on as time has continued. Now, we do have a lot of resources in professional football, and I know I'm speaking to some people who may not have similar resources. And in order to kind of have that monitoring, but I think it's important to make sure that the processes are there, because when people get back to playing football, there will be many questions that are asked, and they inevitably will go towards the most senior person, which will be the coaches like yourself. So just get your information correct, I think is really important. And then there's the very simple things that players need to know about sharing drink bottles and kind of not spitting, and good cough etiquette, and making sure that the equipment is clean, and what social distancing actually means, and what is safe in football. Why is football being allowed to actually occur? Because people are worried about any sort of contact within a metre, but in football a lot of the contact is very transient. So if people are asking questions, I think it's important that we educate and actually explain things in the right way. And we try to do that a lot at our club. And we had a Zoom conference between all the Championship and Premier League doctors. So we all tried to give the same message. Now that's not always easy to do. As you can see, in some clubs, people made decisions about not playing because of various anxiety issues. And I think that really stemmed from understanding why we felt as a group of medics that it was safe to return during this time. So going back to mental health, FIFPro is the umbrella organisation for the PFA. So the PFA works in England. FIFPro is an organisation that covers all of the PFAs from various countries. And they did a study, again, that I was involved in, where they looked at 1,600 professional footballers in Holland, France and the UK. And they did a questionnaire for them direct to the players in March and April, just at really the peak time of the pandemic. And what they found was that depression was twice as high and anxiety was 3 times as high as exactly the same questionnaires that were done prior to COVID. So they had already started the study in January, and they just repeated the questions. So you can see that, it's obvious, but people were more anxious and people were more stressed during that time. But it's nice to have some evidence within professional footballers that was the case. And there's an ongoing study from Jake, which will continue to follow on players as they continue in their careers, to see the impact of COVID, and also the impact of people who are going on to retire from football. Communication in football, I think, is really a big deal. So I try to set the scene by talking about my environment in football. And people, when I give talks to those who are not working in professional football, they often ask about communication, what players are really like. And players, in my experience, are very, very streetwise and tough and very smart in terms of their communication. So this is a picture that always reminds me of that. It's Alex Ferguson on his first few days at Manchester United, and it's almost, he seems like the person who's more worried, and the players are actually checking him out just so that he can prove to them that he knows what he's talking about. And I think it's very similar in some of the stuff that I do. When I'm giving presentations to footballers, I really make sure that I know my stuff, or try to know my stuff really well, because they ask questions and they really want to know some of the details. So it can be a tough environment, but if you're prepared well, and it's about managing groups and being able to kind of give information in a way that everyone can relate to. So when footballers come to an academy, they can often come quite young and quite mollycoddled in a way, and it's quite nice to see how they develop during an academy and how they try to cope with some of the pressures of many people around them, and then they go out and start playing and see the real world of football, which is tough, and it gets tougher the higher they go. And so footballers do have a lot of pressure, and so that's part of the reason why I've been asked to kind of talk about mental health in football as such. So what in particular is it about football that can lead to kind of increased mental health issues? So there is certainly pressure to perform, and massive expectations, both from the club, and they're of course a business, and clubs want to be successful, but also expectations from their family, from their friends. There's continually monitoring. Now, when I talk about monitoring, the first thing that comes to my mind as a medic is the monitoring that we do. We know how much they run during game, how much they sprint. It's all continually monitored during training and also during matches. So as such, nowadays there's no hiding place, but they're also monitored outside of the pitch. So on social media, they've got massive followings, and people are contacting them all the time. And yes, footballers do read what's been said about them, and they do respond to them and do get affected by those. Sometimes I show a slide where I've got footballers who are in the academy before they join the first team, and you can see that they've got about 3,000 or 4,000 followers. And as soon as they join the first team squad on a pre-season tour, the amount of followers on social media jumps up to 20,000, 30,000, 40,000 almost overnight. So you can see the pressures that they can be under. Injuries are a big thing, whether it's professional football or not. If you've had 3 or more long-term injuries, they can have a 3 times higher risk of having anxiety or depression. But that's known because they've got a 3 times more higher chance of actually talking to someone and talking about it. So they would spend time in the physio room, and they can actually spend time talking about some of their issues. Managing change, I think that was one of the questions I just noted. There was a question that Riz mentioned about weight gain and weight loss. And for me, that's about managing change and changing behavior. And the person that asked that question, who said that you can't just simply tell someone to kind of lose weight and that will happen, is absolutely right. So that voice of change, if it comes from us as medics and coaches all the time, it doesn't necessarily translate to the person changing behavior. So the most important person, if you're going to try and change behavior, is the person that needs to change behavior. So engaging, taking a step back and really engaging with them, they're more likely to change behavior if they trust you. And so most of the background work that many good coaches do is about gaining trust. If you can gain trust, you could then use your communication skills in order to try to push people along that behavioral change. So that's the approach that I would use for any sort of behavioral change. Gain trust and make sure that it comes from them in terms of the behavioral change, rather than you directing and telling people how to do those. And I think Riz used quite a good phrase when he said that it's good to put your arm around people sometimes. And I think there's a lot to be said for that. Other things that can impact are things like contracts, addictions. They're young men that I'm dealing with that have a lot of money and a lot of time. So addictions, whether it's alcohol or whether it's gambling, can cause issues, and retirement, certainly. Any sort of big massive change in your life, or whether it's retirement in your 30s, or whether it's retirement when you leave an academy at the age of whichever age, I think it's a big deal. So there's some of the things that people do tend to go through when they're kind of leaving professional football. And the big thing is having support networks. Okay, and that's probably the next bit that I'll talk about for the last bit of my presentation before I take any questions. Support networks. So I believe that the best, the most important relationships in football, and that's whether it's professional or not, are between player and player, or player and coach. Okay, so we have many other people in football, especially in professional football. The higher you go, there's more people, there's medics, and I've got a big team of 50 myself. But the key relationships are between player and player, and also between player and coach, in my opinion. And in order to affect players, in order to kind of pick up on mental health issues, in order to then signpost them to the right services, players need to know that we care. And the best way to show that you care is by communicating well. The single best way of communicating well, from all the evidence, is to listen. So if you're a good listener, you're likely to be a better communicator. Now, I know that sounds very obvious, but that's something that I spend a lot of time talking to fellow doctors about, and also to coaches about how we can actually improve some of our communication skills. And the last bit is really inherent to us as coaches and medics, to be really interested in the player. Do you really want that player to develop? Do you really want to know about their social life? Do you really want to know about what is actually affecting them? Because only then can they open up to you and start telling you some of the early signs of mental health issues, which we can then pick up on, and then you can then signpost them towards the correct services. So what can we do as staff? Culture. One of the biggest things I've heard about in football, whenever I come in, people talk about culture. But there's quite a lot of talk and not enough of us actually doing the culture, because really the culture is us. The culture is you as coaches and us as medics and the senior players. So we are the culture. So actually not just talking about kind of changing culture, but actually doing it. So it might need a meeting at the beginning, but how do you actually live it out? Because only if the culture and environment is right that people feel more comfortable to trust people, and they'll be able to bring up some issues. Football is very competitive, but it's important to maintain that. And you'll hear phrases such that, if you start talking about mental health, then the environment will go soft. No, it's not about being soft or being tough. You still maintain that competitive aspect of football, but just be respectful with each other. So bringing up stuff in a direct way, but in a really respectful way. And I think, in my experience, many coaches and footballers respond to that. We should be seen as staff as people who develop young people, but I put players there, but I really mean young people. So we're there at quite important times in their lives. So if we can be one of the key influencers, hopefully we can help them develop. And I mentioned again about communicating better. Now, if we communicate well, we're more likely to pick up on changes in behaviour. People are more likely to talk to us about things that are affecting their mood. You're more likely to notice if they're not having breakfast like they did, or they're turning up late to some aspects of training, or not really eating properly at lunchtime, or they're being a bit more withdrawn. You might notice that they're more edgy, or they look more tired and they're not sleeping the 8 hours that's recommended. So I think once you've got that foundation of trust, recognizing behavior actually is not that difficult, because if you've got the trust, you can communicate better. If you can communicate better and you're interested in players, I think you're much more likely to pick these things up, which is why I actually link in not just with coaches. I link in with the kit man. I'll link in with the administrator who spends so much time with the people. Or we'll link in with the host families for some of our younger players, because in a day they'll be spending a lot of time with those other members of the staff, and you can actually pick up important things from them about changes in behaviour. And then, of course, the idea of this talk, or any talk I give, is not to turn people into doctors, because when you recognise things, what do we do next? You can then signpost them. So I've said what we do in the professional game, where you've got medics like myself and other colleagues who can help out, and the PFA with their support system. But if you haven't, and you're dealing with non-professional footballers, then signposting them towards their GP, to self-help, to online services at an early stage, I think is the right thing. So I think the preparation we can do, or you can do as coaches, is to make sure you know the pathways for that, if and when you come up with situations of players who do need help. And then the next thing that you can do as coaches is just to check up with them again, just to make sure they're better. Now, I know what I'm saying is very obvious, because some of you natural communicators, or some of us natural communicators, will do that anyway. But many other people who don't really want to get involved, who aren't as interested, might say, well, I've done my job, I've pushed them onto someone, and they have to follow things up. But it's good to kind of follow things up and make sure that people are better. And genuinely, I believe footballers and non-footballers would appreciate that quite a lot. So, Riz, you'll be pleased to know it's my last slide before you ask me any questions. But some of the take-home messages. I think know your club or your environment or your establishment. Create a supportive environment where people can bring up things, but also it's not perceived as all the time you're just talking about mental health. I think it should be across the environment. So it shouldn't be that when we're talking about mental health or child protection or any of these big areas that it's kind of a room in the corner of your club or your organization. So as soon as a child protection or a safeguarding issue or a mental health issue comes up, you go to that corner and speak to that person there. It should be all of us should have a little bit of knowledge, so therefore we can create an environment where we pick things up, and then we signpost them towards other people. Because if we're really truly interested in people's health, where we should be not just interested in their physical health, but how fast they run or how strong they are, also their mental health and actually their social health, finding out about their interactions with people within the club and also outside. We can then hopefully develop players who are more resilient. So if they take setbacks, which will inevitably happen in all walks of life, they're more able to kind of cope and deal with them. And I think the best chance of that is by having the right players and staff that actually care, the right communication amongst us, which I can talk about more certainly when we get any questions, and having the right support networks within the club and also access to kind of support networks outside. I think I'm just about on time, Riz, so I can stop sharing now if you want, and you can firstly ask me any questions that you'd like to, and if anyone else, whichever way you've got other people asking questions, I can take those as well. We've got about 20 minutes left.
Cheers, Doc. No, that's very interesting, actually, and some great points you brought up there. And thanks for asking the questions that obviously asked. I know some of the guys have got questions. One of the ones that I've got, I'll come to you as well, Seth. This 1 minute, mate. One of the questions that I've got is, what steps and actions would you recommend for players, clubs to take in order to minimise players' mental health, especially for those players who are being released from clubs or can't, go training with someone because of the social distances, or clubs are just not being trialisted? What advice or the guidance would you give to those players?
Okay, so I think the first thing is to acknowledge that it's going to be a difficult time. Okay, so whatever we say or do, there's likely going to be a stress response for that. So any sort of life events like that, like retirement or losing your job or break up in a relationship or bereavement, is going to cause stress. Okay, so that does not necessarily equate to them being depressed. So I think accepting that it's going to be a difficult time, being there to kind of support them, but also then looking at some of the signs that you could think, actually, it's gone beyond that. So is it something that's affecting them every day? Is it something that's affecting their function socially? Or have they stopped enjoying things and kind of stopped meeting up with some of their friends? Have they become a lot more withdrawn? And then thinking, actually, is it affecting them physically? So are they not sleeping well? Are they not eating well? So if it becomes to that stage, you could then consider then signposting them towards an appropriate medic who could then see whether actually it's gone beyond the normal acute stress response, and actually you're getting more towards the realms of them having clinical depression or anxiety, because there's different ways of treating different things. So if it's that case, then they may require certain therapies, like talking therapies, or indeed any further treatment if that's the case. So what I tried to set out was firstly recognizing and then putting people towards the right people, but still being that friendly person who's there to kind of recognize their issues and problems.
Brilliant. Zesh, if I come to you.
Yeah, I won't take too much of your time because obviously we're in contact already. Just from coaching, with coaching hat on in terms of players, obviously you have different characters in the dressing room. During this time, there seems to be some people that are more late or more disillusioned or not quite with it. What's the best way to gauge whether it is a mental health issue? Is there a set of questions? Is it a direct question? Is there an indirect way to probe? I know there's not one way to do it and it depends on the case, but if there's an ideal way, how would you go about it? If, for instance, someone's a repeat offender, always late,
yes,
always comes in and he seems to have other things on their mind, what would be the best way? As I said, it's not one easy way to answer that, but just in your opinion.
Yeah, no, I think that's a really nice question to ask, because I do a lot of a technique called motivational interviewing, where it can help improve some of your communication skills. It's something that medics can do and non-medics can do as well. And it's just a way of phrasing or asking questions where you allow people to tell their story. So I think you use the phrase, you know, do you do it directly or how do you do it? You can certainly be direct in a very respectful way, but most of the time people need some guiding, don't they? They need that arm around the shoulder, and you need to get the time to be able to do that. So firstly, I think would be to have the time and kind of asking permission and being respectful. In terms of communication skills, one of the things that we try and do is to ask open questions. And by that I mean questions where they don't just have a yes or no answer. As medics, as coaches, we're often told to ask questions and let them give you the answers and trying to kind of come to a solution. Actually, I think we can be much more skillful than that. So we ask them questions, but then just hold back a bit and just really improve some of our listening. And when you're listening, Zesh, what I would do is I try to tell coaches to actually reflect some of the statements that they've said back to you, because then that allows them to say to you, yeah, Zesh, I agree, you got me, you understand what I'm saying completely. Or no, I didn't quite mean that, what I really meant was this. And then you get closer to understanding them. So not just bombarding questions all the time. When you're asking questions, open questions, and sitting back, allowing them to tell a story, and then picking up some points of what they've said and reflecting it back to them. I think you're better using those methods.
Okay, just one very quick follow-up. I know there's a lot of people waiting. If you suspect or if you feel that it's an addiction, either gambling or drinking, is it open questions again, or is it a different approach?
Okay, I think it's a similar approach. I think people do need to feel comfortable and actually be able to tell their story and be able to tell you. But you can be direct as long as it's a safe place and you feel that you've noticed a change in behaviour. I would speak to them about it and just tell them that actually, look, I just want to just try to see if there's something that I can do to help. I hope you don't mind, but I have noticed that you're doing similar things quite repetitively. Is there something else going on? Is there something that's non-football related that could be affecting you? I'm only asking because I want to try and help, and I think and it'd be good just to hear your side of the story. A general open statement like that, where you're actually caring and you're interested in the person, I believe you're more likely to kind of get them to talk to you.
Perfect. Nice one. I'll let other people crack on. Cheers, mate.
But there's one question in the group chat that's come in. That's from Saf Rafiq. Should we be highlighting the advantages of positive mental health and well-being on performance more with players to encourage them to proactively help themselves with their mental health?
Yeah, I think that's put really nicely, actually. So when you're young and you want to be a footballer or in any sport or any walk of life where you want to be the best, you need to be able to take information, and it has to relate to you. So if you as a young person, the most important thing for you is your performance on the pitch, whatever sport you're in, that's really important to you. And we have to remember that. So if you relate it to their performance, which we know stress, anxiety, depression, mental health can affect their performance, I think that's a nice way to be able to engage with the person. It might not be the answer, and it might be other underlying issues going forward, and other solutions that you need to work out with the player. But if you've both got a common thread that you want to talk about first and a common goal, you're more likely to be able to work with the player. And as I've said before, with the obesity example, only that player can make that change. With the best will in the world, Riz, your colleague, you can say whatever you want to someone, you can shout at them, you can do the hairdryer treatment, whatever else. It's not going to work unless that player engages you and trusts you. And I think that's a really key point. So if you pick up on things that they want to talk about, I think that's the right method to start.
Thanks, Doc. Peter Wong, I know you're out in Hong Kong, very keen.
Okay, thank you, Rish. And hi, I'm Peter from Hong Kong, and also I'm now working with Zesh in the academy as well as in the first team. And just quick questions. Just want to ask you, how can we help the young academy players, especially for the new academy players, to integrate with our teams? Because every seasons we will have some new players to be selected from the trials to join the academy, to join our academy. And due to COVID-19, we don't have the trials, and also maybe we have the trials, But maybe right after the trials, maybe we just have maybe 1 or 2 weeks for preparation, and then we go direct to the competitions. So how can we help the new players, new young academy players to integrate with our team so smoothly, or also maybe to help them to adapt to the new environment? Thank you.
Yeah, no problem at all. So that's something that's really important, whether it's COVID or not. So how can people adapt? Because they're going to be really nervous and anxious. It's a big opportunity to come into a club. We know that most people, some of the stats in England are less than 1% of people who join a club at under 9s, for example, will actually end up being working in football as a career. 80% of people who are signed as scholars who join a club, they won't end up working in or being professional footballers. So it's a big deal, because when I think about people adapting or joining an environment, I think actually let's look at them as a person, not just footballers. I think they have to understand the environment, which again is similar to what I did in the beginning, where I set the scene. I talked about our club, our foundation, our what we're trying to achieve. If you can get your players, I believe, to understand what your club is about, what the values are of that club, what the culture is, I think they're more likely to engage and more likely to settle in firstly. I think involving their families is important, because I think families and parents, we try to kind of involve their parents when they first come at the beginning, and their host families if they're going to be staying at a different family while they're playing football, because I think everyone needs to understand the aspects that I talked about in this presentation, that actually football is really tough. It's a tough environment, but it's a tough environment full of some of the best people that I've worked with. I work in hospitals, I work in general practice. There's some really, really good people who care, but still it's tough because the reasons that I showed you in that why me slide, they're being monitored, they're going to be looked at every aspect. So I think if the players can understand that, and their families can, it should relieve some of the pressure, and that they can see that you as a team are there to help them. And I suppose that's the final bit. How can you be there to help them? Now we have to do things remotely, showing your face, doing presentations, having pictures of the training ground, showing what kind of training regimes you do for the players and their families. I think the more information you can give them in an easy to process way will probably prepare them better for when they actually come to join you. Does that answer your question?
Yeah, okay. Yeah, that means maybe we need to deal with the players as well as their parents, so that we have a better communications with each other, so that maybe they will feel better afterwards.
Yeah, and the kind of information we give is we do group things like this, but also it's important to, I believe, back them up with individual information. So like messages on WhatsApp. We send players little videos like of tours of our ground on WhatsApp. We give them top tips. So I did top tips during COVID, which again I can share that you can share with everyone. We sent that to each individual player. We did them up with infographics. So you don't have to make them up yourselves because the information is out there. But I think the more you prepare in those aspects, that they've got group discussions, but also individual, if you've got the resources, I think that's a better way to try to help them settle in.
Okay, thank you very much. Thank you.
Thanks, Doc. What I'll do, I'll come to Cheatham, and then I'll come to you, Rupesh, as well. Cheatham. Cheatham, you there? Are you frozen? Or I'll come back to Cheatham. Rupesh?
Hi, can you hear me?
Yeah.
Hi, thank you.
Oh, I think Cheatham's back.
Very much. And that was really, really insightful. Another really good set thoughts around.
Cheatham, are you there? Go on, mate.
I think we've got a bit of a delay, but Cheatham, if you want to go ahead.
Can you hear me now?
Yeah, now it's good, yeah.
Yeah, sorry about that. I'm actually at my brother's shop at the moment helping out, so the internet might be a bit bad. Yeah, I just wanted to get your thoughts on moving forward. What do you think the difference in sort of that sensitivity and language around COVID and those who may have experienced this time in a very different way? We've had some discussions internally at my workplace where I've obviously suffered a massive loss in my family. So for me, the situation is very different to some people who say, look, it's just lockdown. Whereas for me, it was truly COVID-19. And how do you think that language around that will change moving forward?
Okay, so really important. So being sensitive, that actually this time has affected people in very different ways, and again, that's something that we spoke to with our players and with our staff, that actually for some people their focus was just getting back to football, getting back to playing. But for other people, they may have had a direct family member who was affected. They may have had friends who were affected. They may we had players whose wives were heavily pregnant. We had players who lived with their parents, so they were not as interested in how safe it was at the training ground. They were more interested in how safe is it going to be when you actually get back. I think that's something where if you're in an environment or a culture where people don't they do take it seriously, and they don't kind of belittle each other, but they're actually there to kind of understand what other people are going through. I think that's probably the key thing. So everyone's situation is different. Everyone will have been through many different things. Fortunately, most people won't, and especially young athletes, won't have been through these things themselves directly, but some have. So we had in our club 2 family members of players or staff at the club passed away or died during this time, during COVID. So everyone knew about that. Everyone sent them messages. Everyone supported them directly. But also, some of those people wanted to get back and see work as a bit of a release and come back into work. So I think it has to be dealt with on an individual basis. In my practice, again, we had 2 people affected. One person, and this is directly affected by parents who died, one person got straight back into work after a week. Another person took 3 months off and is still off. So I have to say, I believe it has to be individual, but I think you have to be very respectful that people have been through very different things, and it's affecting different people in different ways. It's a really good point.
Thanks, Doc, and I hope that answers your question, Cheetham. Rupesh.
Hi, Doc.
Hello.
Hi there. So my question is, sometimes you might be working with a player or a member of staff who perhaps isn't directly dealing with mental health issue themselves, but might have family members who are. And so you might not be dealing directly with the person who's suffering from these issues, but perhaps is dealing with the consequences. What do you think is the best way to support someone who you know is has got a family member or close personal friend or a partner who's going through these mental health issues?
Okay, so the first thing I'd say, it's good that they're able to kind of bring that up to someone like yourself. So what they've probably demonstrated is that you're a trusted person, and they respect your views. You're probably seen as someone senior to them and someone they look up to, and they might not be as comfortable going to the actual people they probably should go to, like the medics or anyone else. So that's one observation that I'd make. And so that's why I think all of the people on this talk who are coaches have, I believe, some sort of responsibility to find out where the right place to kind of send people to. So if they're in England, then I'd recommend that they might want to kind of consider speaking to their own doctor to see whether they actually need to have further help. I've given you some tips about how you can gently find out, in terms of how it affects them if they're not enjoying anything, they're not eating, they're not sleeping, they're not concentrating. If it's affecting to that level, they may well need some extra help in terms of talking therapies that they can access for free in the UK by their own doctors, and similar with actually their relatives. So sometimes it's just that offloading, just that ventilating of their feelings that can make people better. So they're treating you almost like their own doctor, their own GP. I see, well, before COVID, we were seeing up to 30 patients a day. Many of the patients I saw, I didn't do anything for. They came in here for 10, 15, 20 minutes, just talking about some of their feelings, some of their anxiety, and I would just give really common sense advice and approaches to that, and they felt better without having to take medication, without having to actually see a trained counsellor or psychologist. And that's quite powerful, because we ourselves become part of the treatment, part of therapy, just by listening, just by communicating. But I would say, don't take on that responsibility yourself if you're non-medical. Have a think about where you can signpost them and where you can actually safety net in case things get worse. So, for example, know about their GP, know about the 111 service in England, know about the Samaritans. I believe all coaches should have a Samaritan number on their phone, so they can then just forward them onto their players. Therefore, in your mind that any of your players, that even in the middle of the night at 3 a.m, if they want to speak to someone, they can phone the Samaritans. So having little things like that, putting thought to it, I think would be quite useful. Okay.
I got another question from Emma Marlowe. I think it's a very good question. And you mentioned it earlier in your talk about, you didn't show the slide, but I know when players overnight they can go from 1,000 followers to 12,000 followers.
Yeah.
How can we as coaches support players who receive negative messages online through social media, given how big it is in today's society? We've seen it recently with some of the players' racist comments they received online. So how can players be supported to do with those messages through social media?
Yeah, I think that's tricky because it's kind of a new phenomenon that's happened in recent years. When I talked about us as coaches and medics, we're getting older and older and more experienced and presumably better at our jobs. But the older the more that happens, we're moving away from the very people we're trying to influence, those young people. So the answer I'm not going to give is to tell them, get off social media, just ignore it and carry on. Because for me, that shows a lack of insight about what young people are going through now. Young people are on it. Young people want to be on it, and it's very hard for them to be off. So the next question is what we can do to kind of help them. Some people develop their own coping mechanisms. So do they actually want you to get involved? Do they want you to kind of be there to kind of scrutinize what's happening on their social media? In my experience, it's a little bit similar to Zesh's question earlier. I choose a kind of a private moment and just ask them respectfully if they want to discuss it or not in a confidential way. I'm very close to the players because my room is right next to where the players' dressing room is, and also the treatment room. My door is open, but I still, in a week, about 10 times with players that I've known for years, I'll just remind them that what they say to me is confidential, that I won't pass on to other people unless I really have to. And I think that developing and gaining trust will allow you to then speak to them about social media and see whether it's something that they want to address or not. Because many players are actually finding they develop their own coping mechanisms. If they haven't, you could then signpost them towards help that could be there that I've mentioned before.
Brilliant. Cheers for that, Duck. I'm also conscious of time as well. That's nearly an hour now, so I don't want to take too much of your time. I know you got a busy week ahead, and obviously back to training. First, I'd like to thank everyone for joining the call. The guys from Hong Kong, Germany, Dubai as well, and obviously the Surrey FA and James Chadwick, obviously supporting the Zesh Foundation, and obviously getting this off the ground as well. And my trustee, obviously Cheadle, on the call as well, which has been, and some of the young guys that has me who are on the call as well. So like I said, guys, this is a very important topic. There's opportunities for everyone everyone knows someone who may be affected by mental health. Sometimes you can't even see the signs. So I think the key message really is having that conversation, talking to someone, having the contact details of where to signpost them. If you're not spoken to someone for a while, why not now and then give them a call, drop them a text message or WhatsApp, a voice note, because it helps as well. And for you coaches who you've got kids coming back from football, they've had no school, take that time, build that one-on-one development plan with them. We all have our personal plans, personal goals, but let's start having that conversation with our young players, because ultimately they're the future players, they're the future role models. So before I get too passionate, that's enough from me anyway. But thank you all for your time, for your call, for your efforts, and hopefully we will see you all soon, and good luck in your coaching careers and moving forward.